Alrighty, well hey everybody, this is Dr. Bulow, and this month we're talking about Revive Chiro Kids. If you look in your social media and you put the hashtag Revive Chiro Kids, what you're going to find are topics having to do with new moms, pregnancy, children, infants, pediatrics, mainly surrounding spinal health, but perhaps also nutritional health and other things. I wanted to start off our Revive Chiro Kids this month talking about pregnancy and delivery. And that's what our little pop quiz is today. One doesn't necessarily equal minus 25%. It doesn't really make any sense. So let me tell you what these numbers mean and how it relates to our theme this month, as well as women who are expecting a new addition to their family. There was a study done in the 90s, and it looked back and it did some statistical analysis on women that were pregnant. And it found that women who were under regular chiropractic care through their pregnancy, when it came to their delivery, their labor on average was 25% less time in terms of how long their labor was than women who did not report being under chiropractic care regularly. And that was their first pregnancy. For women that it was their second or third or fourth pregnancy, those women that were under care throughout their pregnancy, on average, their labor time was 31% less time than those who are not under chiropractic care. This is kind of nuts if you think about it, because I don't know an expecting mother on the planet that if you ask them, would you like to have your labor longer or shorter? And they'd say, I want a long labor, please. I'd really like a long labor. I don't know any mom or expecting mother that would say that. I think most would say, oh man, please keep it as short as possible, as pain-free as possible. And so this was a really cool study to say, hey, look, there's a correlation there. If your hips and your spine are twisted, not only can that cause a lot of back pain and sciatica during pregnancy, but it's probably going to not let that baby settle down the way that it's supposed to settle down. It may not produce the start the hormone secretion on time or muscle contraction. And there's all these different things that go into delivery, obviously. But if the foundation of the whole structure isn't lined up right, it doesn't take that big of a stretch of the imagination to see how it could cause some trouble. So if you are expecting, or you know someone who is, or if you just want to share this because you never know who's watching who might be expecting, or they might know someone who is, and that person wants to have the best odds of feeling good up and through their pregnancy and have as short a duration of a labor as possible, then this might be for you. We have a practice here in Cranberry Township, which is north of Pittsburgh. So we serve the greater Pittsburgh area and pretty much all of western Pennsylvania. But if you're outside of this area and you're watching this and you don't know where to start, let us know. Message me, put a little comment if you have any questions, or put a comment with your zip code. We'll find you a very qualified, specific chiropractor that can help maintain your spine through the duration of your pregnancy and then keep you checked and have your baby even checked afterwards. We're going to be talking about that in the future. So hopefully this gives you some hope, give you some light, give you some information. If you have any questions, let us know. Otherwise, thanks for hanging out with us today, and we'll see you next time. Bye now.